Ligature mark is a type of pressure aberration due to continued pressure by ligature on the salient features both in seen hanging and strangulation. Strangulation mark appearance is usually seen as a furrow or groove in this tissue, which is usually soft and pale initially, but the skin dries up, become hard, parchment, dark brown. It runs from a midpoint of the neck upward, outward, backward from the ear side to reach behind the neck where it is deficient. It is the most unspecific sign of a death from hanging. Follow things must be noted. Its position usually it is usually at the front of the neck, but rarely at the back of the neck. If it in a front in position with respect to the thyroid cartilage, ligature mark is situated above the thyroid cartilage. 80% cases at the level of 15% and below the level of 5% cases. Ligature being below the level of the thyroid is more in partial suspension, more in its direction, whether it is continuous or interrupted. If piece of cloth such as shirt collar is interposed between the skin, depth and width area of neck involved in relation to the landmark. Compare with the weight of the body. Heavier the body, deeper the ligature. Degree of suspension. Complete suspension produces a deep mark. Complete suspension process a deep mark. Partial suspension partial suspension causes shallower. Time of suspension, longer the suspension, longer the suspension, longer the suspension, deeper the groove. With a long suspension time, even lesser weight of the body and wider ligature can produce a deeper groove. Sometimes a line of congestion and hemorrhages. Lines of hemorrhages seen along the edges of the groove. If present is strongly suggestive of antimotor hanging. Ligature material. If the ligature is shown in a pattern aberration does match with the ligature pattern is better appreciated by a magnifying exam under oblique lightening magnifying glass. Okay. Magnifying glass. Effect of slippage of ligature as the victim slice. If the effect of the slippage of the as the victim ties a ligature around the neck, it may produce a very faint and superficial impression when victim suspend himself. Ligature move upward, backward, produces a second deeper impression above the initial impression. The ligature material is rough. Example rope. The two ligature marks may be joined by a fine abrasion representing the movement of the ligature upward. The fibers, although the ligature mark may look clean, there are always some small fibers sticking to the ligature mark. Stripping them off with a sticking tape. Security to a glass lid and seen under microscope. These fibers must match with the ligature found at the scene. And re-examine after some hours. If body is fresh, ligature mark not be evident. After drying, the ligature mark becomes a more prominent pattern of the ligature mark. The ligature mark in the form pattern aberration. Photogrammer describes the pattern. The pattern is not clear in ordinary light. Examine public light under UV light. Compare with the pattern of the ligature recovered, and if they see match, absent ligature mark. If the ligature mark is absent, does not exclude hanging. Causes of absent intestinal ligature must be soft ligature material. Example, scarf, towel, beard, or a piece of clothing getting caught between ligature and the skin. Decomposition may be obliterate ligature mark when pressure is applied in front of the neck. Mark present in the absence of hanging. If soon after the ligature is passed around the neck and the body is dragged along ground with itself, a ligature mark very similar to that of hanging may produced by resembling ligature, especially subcutaneous fascia has been around the neck. Shirt collar. Neck tissue swell due to decomposition. Decomposition due to the front of the produced by dragged along the ligature very similar hanging produced by infant and obese person. and thin folds on neck may resemble ligature mark, especially subcutaneous fat has been coagulated by refrigeration. Jewelry and clothing around the neck, shirt or neck tissue swells, and due to hanging, neck tissue swell due to decomposition, folds mark resembling that of a strangulation or hanging may produce histologic examination ligature mark is similar presence of the vital reactions. Indicate the antibody hanging suspension peak, that is the junction of the noose and the vertical part of the rope. Point A, pulled upward away from the skin due to weight of the body. Thus, no ligature mark is left at the back, at the back A. A triangle ABC is formed at the apex of the, which is called as the suspension peak or point. The suspension peak is the distinction feature by hanging from strangulation, as weight of the body does not act on the ligature in strangulation. Such a suspension peak is typically absent when the knot is in front because of projecting chin on which a knot often leaves its mark. Thank you.